A significant change in U.S. public health policy occurred on Tuesday, May 27, 2025. Health and Human Services Secretary Robert F. Kennedy Jr. made a pivotal announcement. He declared that the agency would no longer recommend the coronavirus vaccine for certain groups. These groups are healthy pregnant women and healthy children. This decision marks a notable departure from previous stances. The implications of this policy shift are currently unfolding. Many are watching closely to see the full impact. This news has already started generating considerable discussion across the nation. The announcement was delivered through a concise, 58-second video. This video was posted on the social media platform X, formerly known as Twitter. In this brief message, Secretary Kennedy stated the change directly. He confirmed the COVID-19 vaccine had been removed from the CDC's immunization schedule. This specifically applies to healthy pregnant women and healthy children. The directness of the announcement was notable. It bypassed traditional longer channels of communication for such major health policy changes. The use of social media highlighted a modern approach to disseminating information. This move is particularly striking given the context of the COVID-19 pandemic. For years, public health messaging centered on widespread vaccination. The focus was on protecting vulnerable populations and the broader community. Removing recommendations for these specific demographics signals a new assessment of risk and benefit. The term healthy is key in Kennedy's announcement. It suggests a nuanced approach, possibly distinguishing between those with and without underlying health conditions. This distinction will require careful clarification for the public and medical providers alike. The specifics of what defines healthy in this context are yet to be fully detailed. The decision immediately raises questions about the scientific basis for the change. It also brings to the forefront ongoing debates about vaccine safety and efficacy. Secretary Kennedy has, in the past, expressed skepticism about certain vaccines. His current role as HHS Secretary places him in a powerful position. He can now directly influence national health guidelines. This announcement is therefore not just a policy update, it is a reflection of a potentially new direction in public health leadership. The ramifications will likely be felt for some time to come, affecting trust and vaccine uptake. Secretary Kennedy's decision is an unprecedented move in several ways. It notably bypasses the traditional system of vaccine advice. This system has long relied on the Centers for Disease Control and Prevention, CDC. The CDC's expert panels usually deliberate and issue recommendations. These recommendations then form the basis of the official immunization schedule. This established process involves rigorous review of scientific data. It ensures that public health guidance is evidence-based. The direct intervention by the HHS Secretary is a clear departure from this norm. The CDC has historically been the nation's leading public health agency. Its recommendations on vaccinations are typically followed by states and healthcare providers. By directly removing the vaccine from the schedule for these groups, Secretary Kennedy has sidestepped the CDC's advisory committees. This action could be interpreted as a challenge to the CDC's authority. It may also signal a shift in how vaccine policies are formulated at the federal level. The independence and scientific integrity of the CDC have been cornerstones of public trust. This move could potentially undermine that trust. This direct alteration of the immunization schedule by an HHS secretary is highly unusual. Typically, the HHS secretary would endorse recommendations coming from the CDC. The CDC's Advisory Committee on Immunization Practices, ACIP, is central to this process. ACIP is composed of medical and public health experts. They meet publicly and review extensive data before voting on vaccine recommendations. Kennedy's announcement did not mention any preceding ACIP review for this specific change. This lack of consultation with the established expert body is a significant point of concern for many. The implications for the CDC's future role are substantial. If the HHS secretary can unilaterally change vaccine schedules, what does this mean for the CDC's scientific bodies? Will their expertise continue to be the primary driver of public health policy? Or will political appointments hold more sway in these critical decisions? These questions are now at the forefront of discussions among public health professionals. The balance between political leadership and independent scientific advice is being tested. This situation creates uncertainty about the processes that safeguard public health decisions moving forward. The previous federal guidance on COVID-19 vaccination was broad. The CDC had recommended the COVID-19 vaccine for all individuals aged 6 months and older. This universal recommendation aimed to maximize protection across the population. It was based on the understanding that widespread vaccination could reduce severe illness, hospitalizations, and deaths. It also aimed to limit the spread of the virus. This comprehensive approach was adopted early in the vaccine rollout. It was maintained through various stages of the pandemic. The goal was clear: protect as many people as possible. The new directive from Secretary Kennedy dramatically narrows this scope. It carves out exceptions for healthy pregnant women and healthy children. This shift implies a re-evaluation of the risk-benefit analysis for these specific groups. The rationale cited in the brief announcement focuses on their healthy status. This suggests that the perceived risk from COVID-19 for these individuals is now considered low enough. Low enough perhaps to not warrant a universal vaccine recommendation. However, detailed data supporting this specific change was not immediately provided with the announcement. This lack of upfront data is a point of contention. Public reaction to this announcement has been swift and varied. Some groups, who have long questioned the necessity of COVID-19 vaccines for children, may welcome this decision. They might see it as an acknowledgement of their concerns. Online forums and social media show a spectrum of opinions. Supporters of Kennedy's move praise it as a step towards more individualized medical choice. They view it as a correction to what they perceived as overly broad mandates or recommendations. This segment of the public often expresses distrust in previous public health messaging. Conversely, many health experts and medical organizations have expressed immediate concern. They worry about the potential public health consequences of this decision. Pediatricians and obstetricians in particular may find themselves in a difficult position. They rely on CDC guidelines to advise their patients. The bypassing of the CDC's established review process is a major point of criticism. Experts fear this could lead to confusion among parents and pregnant women. It might also increase vaccine hesitancy for other routine immunizations. The lack of a clear, detailed scientific explanation accompanying the policy change is particularly troubling to the medical community. The immediate aftermath of Secretary Kennedy's announcement is filled with uncertainty. One of the primary concerns is the potential impact on vaccine uptake. Even if the recommendation is only removed for healthy individuals, this could have a chilling effect. Parents and pregnant women might become more hesitant about the vaccine overall. Defining healthy in a practical, clinical setting will also be a challenge. This ambiguity could lead to inconsistent application of the new guidance. Healthcare providers will need clear criteria to advise their patients accurately. Without it, confusion is likely to prevail. This decision also carries broader implications for public trust in health institutions. The CDC has been the bedrock of public health guidance for decades. When its established processes are bypassed, it can erode public confidence. This is not just about the COVID-19 vaccine. It can affect trust in other public health recommendations and future pandemic responses. Rebuilding and maintaining that trust is crucial for effective public health outcomes. The perception of political interference in scientific processes can be damaging. It often takes a long time to repair such damage. Looking ahead, this move by Secretary Kennedy could set a precedent. It might influence how future vaccination policies are developed and communicated. If direct interventions by the HHS Secretary become more common, the role of expert advisory bodies could be permanently altered. This could lead to a more politicized environment for public health decisions. Such an environment might prioritize political considerations over scientific consensus. The long-term effects on the nation's ability to respond to health crises are a serious concern. This single decision could reshape the landscape of public health governance. Ultimately, the full impact of removing COVID-19 vaccine recommendations for healthy pregnant women and children remains to be seen. It will spark ongoing debate among scientists, policymakers, and the public. The decision highlights a tension between individual autonomy and public health goals. It also underscores the evolving understanding of the COVID-19 virus and its vaccines. As more information becomes available, and as reactions continue to pour in, the consequences of this bold move will become clearer. The public health community will be watching very closely in the coming months and years.